Welcome to NAFDAC and Your Else. Here we bring you up to date with NAFDAC's activities with regards to its mandate of safeguarding the health of the nation. I'm your host. My name is Tosin Omolaja. Today on the program, we'll explore another aspect of the agency's regulatory oversight functions as it relates to misuse and abuse of prescription medicines, the dangers of self-medication, and the agency's policy and regulatory drive towards ensuring less and less Nigerians suffer the effect of adverse drug reaction. Self-medication is the act of using or consuming medicine without prescription or supervision. This practice is very prevalent in Nigeria and has led to serious effects, and in many, these effects have been fatal.
First of all drugs have one side effect or the other. If you use Panadol too much, as safe as we think it has side effects. But there are some drugs that have very serious side effects, and side effects that you don't expect, that may be harming the patient. When you develop a drug product, you have to take the drug product through clinical trials. It is through clinical trials you start watching, actually preclinical trials. You give them to animals and rats and mice and whatnot, and start watching what is going on with them, whatever you want to see. At the preclinical trial stage, you can say, oh, I observed this, I observed that. But we are not animals. Animals are not us. There are some animal models that are closer to human beings, like pigs, But after the preclinical, you go to clinical stage. And you have phase 1, phase 2, phase 3. During those clinical trial phases, you start noting the side effects. You ask the patient, how do you feel and whatnot, or you've already written things down and see whether you are observing them. It is after phase 3 clinical trial that a drug is approved or not approved. Okay? When you approve a drug, it's not because they are free from side effects. It is that it's a risk-benefit ratio. Do the benefits outweigh the risks? If they outweigh the risk very well, then it's good to be used, but you now put it down in the package insert or leaflet insert that watch out for this, for that. At that point, you may say it's not, pregnant women shouldn't use it. If at the preclinical stage, it's aborting babies of animals, that is a signal, that it cannot be used during pregnancy. That's just an example. However, once the products are approved, post-marketing stage, that's what you call stage 4. That is when you start doing post-marketing surveillance. You start now, because the differences between phases 1, 2, 3 are the number of subjects used. Phase 3 has the largest number of subjects. But phase 4 can become thousands and millions. So things that are reactions that you don't find in the lower numbers, you may start finding them in the bigger numbers in stage 4, which is post-marketing. And that is where pharmacovigilance comes in, when they start noting down, what is going on with this medicine that they didn't see at the early stage. It may be serious, even than adverse drug reaction, that it may what we call signal. For example, if death results, that is signal that you never observed, you mightn't have observed.
The fact that medicines are prone to have side effects and may have varying effects on different people self-medication and drug misuse is seriously discouraged.
Self-medication is not a new phenomenon. It's been there. People have been doing a lot of self-medication, a lot of OTCs on the counter. So self-medication basically is the use of drugs to treat one self-diagnosed disorder or symptom, or continued use of prescribed medication for chronic or recurrent disease. Once we go to the hospital, a doctor prescribes a drug for us. Instead of us to go back, maybe the next time we have a similar symptom, people don't bother going back. They just begin to self-medicate on this medication. But there are a lot of risks associated with self-medication. A lot of risks which, if we don't go for the prescription and we are not seen in the hospital, a lot of risks which you cannot pick by ourselves. Example of this kind of risk is adverse drug reaction or adverse drug event. So basically, adverse drug reaction is a response to a drug which is unintended and which occurs at dose normally used in humans for diagnosis, for prophylaxis, or therapy. But adverse drug reaction is not something that we can pick on our own. So that's why we have to go to the hospital for these drugs to be prescribed for us and for us to tell the doctor if we have any reaction. But if we self-medicate, we won't even know if it is the drug that is causing the reaction. We won't exactly know what we're reacting to. All we have to say is, I'm feeling like this, I'm feeling like this, I'm feeling like this. And adverse drug reaction can be very serious. It can be life-threatening. It can lead to death. It can lead to disability. That's why self-medication is discouraged. And adverse drug reactions are not consistent with applicable product information. That means even if you buy the drug, if you check the leaflet, they won't tell you that this adverse drug reaction will occur. All you will see on the leaflet is the side effect of this drug. So that's why we shouldn't take a medication without prescription, because adverse drug reaction is not written on the drug. Then another risk of self-medication is drug resistance. We've been having a lot of antimicrobial resistance. That this drug that we can use to cure this particular ailment, we can't use it again due to self-medication. Like people are very, very quick to go and buy antibiotics on the shelf. Instead of them to take it maybe 4 times, 3 times a day, some people take it once, which will lead to drug resistance. And this is another effect of self-medication. That's why self-medication is highly discouraged. Then at the individual level, the risk of self-medication can include the following: incorrect self-diagnosis. The diagnosis I'm even making for myself is wrong, and I'm taking this particular medicine. I'm not even supposed to take the medicine, I'm taking the medicine. Then failure to seek appropriate medical advice promptly. You'll be like, I'm having a headache. Instead of me to go to the hospital and tell the doctor I'm having a headache, headache is a symptom of a lot of things. But I'm having a headache, I'm taking paracetamol. Which the cause of your headache, the cure for the headache might not be paracetamol. So we have to be very careful on self-medication. Then incorrect choice of therapy. Some people, they react to a particular drug, but they are not even sure this is even the medication they are taking because nobody prescribed it for them. At the end of the day, you end up taking the drug and you end up having severe reaction to the drug. Then there's rare but very severe adverse effects, as I was explaining the other time. Some people take particular medication that immediately they take the medication, they have anaphylactic reaction, which can lead to instant death. So it is very discouraged to do self-medication. Very, very discouraged. Then failure to recognize that the same active substance is already being taken under a different name. If we go and buy without prescription, we buy this generic, we buy another generic that have the same constituent inside them, which is very, very discouraged, just because we have different brand names, but the chemical substance inside them is the same thing. So we have to be very careful.
A number of other reasons are responsible for this culture of medicine abuse and misuse. However, this cannot justify or account for the resultant effects of such practices.
There are some things that makes people to self-medicate. Number one, history of a disease. Because someone is hypertensive or someone has used an antibiotic before, doesn't give you room to go and buy it without another prescription from a doctor who is supposed to monitor your treatment with that medicine. So the history of a disease. Another one is the easy availability of drugs in Nigeria because of the chaotic drug distribution system. Also makes people to just go to the roadside and purchase any medicine. That's another reason why it's like that. And the third one I want to say is that there is this general belief that medicines are generally safe and they are not harmful. So if they use it, there'll be no problem. But I will tell us a particular drug that is commonly used in Nigeria for self-medication. That is paracetamol. Everybody knows paracetamol. But do you know that overdose of paracetamol can lead to hepatic or liver problems? And people will not know that these things can lead to that, and they just take it at will.
NAFDAC and your health sampled public opinion about self-medication, and we got some reactions.
There was a drug I bought, it reacts on my body. All my system, I'm not fine. I later go to the hospital because I bought the drug, infection, something like that. I bought the drug and I didn't find sin there. I could go to the hospital because I bought the drug is really reacts on my body. And I'm not fine. I have to go to the doctor to go and doctor now prescribe drug for me and I'm fine.
They prescribe 500 milligram omeprazole. 500 milligram for me. After taking like 3 days, I began to feel some reactions in my body. I need to complain again. And after which, the pharmacy said, okay, I should go for 200 milligram. When I take 200 milligram, it had no effect. There was no side effect. But the first one gave me a serious ache to my system.
I will go to the hospital. So when I go to the hospital, they will do tests to know the exact problem. So after then, they will commence treatment.
Paracetamol is my own. When I take paracetamol, I'm okay.
We'll take a short break now. Don't go away. Welcome back. You're watching NAFDAC and your health. The inception of the novel coronavirus may have also made the idea of self-medication even more alluring, with unverified claims of cure or possible medicines for the management of the disease.
The onset of COVID-19 pandemic and increasing number of cases has advanced because of self-medication. And a lot of people are opting for self-care due to fear and due to lack of knowledge on the COVID-19 pandemic. Members of the public are advised not to self-medicate, especially in this COVID-19 pandemic, where there's self-medication on chloroquine, hydroxychloroquine, zinc sulfate, and some other like azithromycin. So we should be very careful. We shouldn't go and buy because they said these are the likely drugs in clinical trials being used. There are some guidance on self-medication, especially in this COVID-19 period, especially with chloroquine products. If we are even going to take the chloroquine product as well, we should ensure that the patient receiving chloroquine or hydroxychloroquine for COVID-19 are adequately monitored. That is, if you have been diagnosed with COVID-19, you shouldn't self-medicate. So they will tell you how to take it, and you should be adequately monitored, and you document and report any adverse drug reaction you notice if you are on this medication. Then ensure that you don't have pre-existing heart conditions that can make the patient prone to more heart rhythm. So that's why we have to be monitored in the hospital. Then we should also report all our concomitant medicines used in the management of COVID-19 during these clinical trials, including azithromycin. So that's why it's very important in this COVID-19 period for you to go to the hospital, they diagnose you, and you take your medication under supervision. Most of these drugs used in the COVID-19 pandemic, they are drugs that have initially been registered, but they've been registered for another purpose entirely. So them being used for COVID-19 treatment, we require them to carry out a fresh clinical trials, which is being monitored by our clinical trial unit, where they carry out good GCP inspection, that's good clinical practice inspection, to these sites where these drugs are being monitored, and they monitor any reaction to this drug, any adverse events or any adverse drug reaction to this medication. Basically, please do not self-medicate in this period. Although we know people are scared, it's a new disease, but we should ensure to always go to the hospital and get a prescribed medication. Please, let's discourage self-medication. It is very dangerous. It is life-threatening.
It's been established that self-medication is not only dangerous but seriously discouraged, and especially frowned at by NAFDAC, whose core mandate is safeguarding the health of Nigerians. The agency therefore engages in several sensitization initiatives, not only to enlighten the general public, including people at the grassroots, but key stakeholders in the drug dispensing and health sector. This sort of educative drive is fundamental to reversing this debilitating culture of self-medication and medicine abuse and misuse.
Training at the hospital levels. If the nurses, the doctors are well trained and sensitized, they will sensitize their patients to report. So it's all about training, and that is part of what we're going to be doing. We are also trying to step up in terms of, we meaning NAFDAC, we are trying to step up in terms of our pharmacovigilance.
Officers of the Pharmacovigilance and Post-Marketing Directorate of the agency regularly visit health centers and even pharmacies across the country to ascertain their level of compliance with several issues relating to medicine dispensing, storage, and even adverse drug reaction reporting.
An ADR form, adverse drug reaction reporting form. Okay. So that for most of your companies or your customers that come around to buy your products, if they have any complaints,
they are visiting. It has improved our practices since this section is set up. Of course, they educated us about adverse drug reactions, the need for us to report to NAFDAC when we observe any adverse drug reaction, both with new drugs and already existing drugs, because you know adverse drug reaction can come in many forms. So it's been a great work they're doing.
Reporting is also a major way of ensuring that less and less people suffer the traumatic effects of adverse drug reaction. Although this may be new for many people, the agency has all hands on deck to ensure everyone understands the importance of reporting reactions to medicines used.
People sometimes they don't want to report. Sometimes they are too busy with one thing or the other, or they will think, oh, it's because I didn't sleep well or whatnot. Even if you didn't sleep well and you think it is lack of sleep that is causing, it's better to still report, because it's number. If it is only 1 out of 1,000 that reported, then very likely. But if 100 out of 1,000 report the same thing, then it will show that it is not because of lack of sleep. So we have a project where we go to the different hospitals. We also supply them with telephones where they can actually call in, make it easier.
If a particular product, supposing is new and is introduced into the market, and people are reacting to it, and the reactions are bad, you know, but as they are coming in, we do what we call causality assessment. We usually assess because there's a national data. All these reports are coming into a data. So, and we study the data from time to time, so that if there is anything, you know, that needs an urgent attention, we can see that from that assessment. Because if we have a particular product and there's a report on that product in Ibadan, you have it somewhere in Lagos, you have it somewhere in the east, you have it somewhere, or even if there's a concentration in Lagos, then you know that there's something wrong somewhere. So quickly, you know, we start investigation. And the investigation may even lead to the recall of that product. If the findings necessitate that, then there will be a recall of such products.
We encourage the consumers, the health practitioners, the pharmacy, the nurse, the doctors to please report any adverse drug reaction. In NAFDAC, we have the yellow form, which it can be picked in any of our offices, and you can directly report. Also, if you go to our website, www.nafdac.gov.ng, we have a new reporting channel, which is the e-reporting. The e-reporting is on our website. All you have to do is click on the website, It will show you the e-reporting, and you can report the adverse drug reaction. We also have something called the PRASCO, Pharmacovigilance Rapid Alert System for Consumers Reporting. In the PRASCO, the line for the PRASCO is 20543. 20543. It is toll-free from all networks. All you have to do is just dial the PRASCO line, and immediately a caller will call you back on any network that you are using. So that's like the ways of reporting. Then you can also report directly to our office, any of our offices all over the country, in all the 36 states and Abuja, including Abuja. You can walk in directly as a consumer and complain directly to anybody that this is the reaction I'm having, and you'll be channeled to the right source. Then you can also report through our email. Our email is pharmacovigilance@nafdac.gov.ng. If you have any report, any symptom at all, you can also report directly. Just send us a mail through the mail, include your phone number. We'll give you a call immediately to find out the details. Even if you don't have the yellow form, we can easily provide a yellow form for you, or we'll pay you a visit to wherever you are, all over the country, in all the 36 states, including the FCT.
Despite the pandemic, officers of the agency continue to carry out pharmacovigilance and post-marketing surveillance across the country.
As we all know, we got to a point of the high peak that there was a complete lockdown. But within that period, we were able to achieve a little. We received a lot of consumer complaints through our consumer complaint hotline, and then we've documented. And then for skeletal services, because it was a period that it was a COVID period, and consumer complaint is what we don't take lightly in PVPMS. So we arranged for an investigation, and then we arranged few officers. We went to those places to investigate, and then we were able to invite few of them that were accessible to come for a consultative meetings. Some of them, we visited their premises to find out those particular products. Especially most of the drugs we receive, most of the products we receive consumer complaints were drugs. And then we visited those places. We invited those people to come for consultative meetings. Some of them, we got to their warehouses. We were able to put some of the products on hold and then sample some of the products for lab analysis.
The agency's advocacy to hospitals and other health centers have also been bearing positive results.
We have received numerous reports from the hospital through our advocacy department here in Lagos. We have also, at this period, we made a lot of phone calls to all hospitals to ask if there are other ADRs that have not been reported for us to be able to follow up at this period. So we have received, and then they are undergoing, the report are being treated according at this period.
Here's where we draw the curtain on this edition of the program. Join us same time, same station next week for another informative package. In the meantime, if you have comments, complaints, or you want to report activities of fake drugs or adulterated food product peddlers, our doors are always open. You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, please call 0800 162 3322 or email nafdac@nafdac.gov.ng. Importing, producing, distributing, and selling fake drugs and cosmetics, adulterated food, and so on are criminal activities that destroy lives. Join the fight against these heinous crimes by reporting any suspicious activity in your area to NAFDAC. Let's join hands to safeguard the health of our nation. See you next week. Stay safe.